Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes, and I'm here to discuss something about the part A reading. Yes, part A. Sometimes please try and understand, guys, that sometimes reading part A or part B or part C when it comes to OET material is not up to the mark. So do not judge yourself. Please understand, we do practice paper not to judge ourselves, but to learn. So please keep learning. Like today, I'm going to discuss about the part A that is normally we have been watching for a long time, but this part A is not very good because as you can see this is related to snake bite. And if you will go to this question paper of part A, so you will find different questions like blackout as a symptom of poisoning. So blackout means unconscious, but in the whole reading there is no word like this which is given. So please do not panic when you do readings of such kind. This kind of a question will not come in exam. But anyhow, if you could relate the word clinical feature to the symptom, that is a nice idea. So you can do that if you would like, but please don't create panic. This kind of a question will not come in the exam. At least you would be able to find the word symptom or some other kind of symptoms that will help you to recognize whether it is given in A, B, C, or D. Second question, and here can be seen underarms. In this reading, nothing like underarms have been given, so it's not your fault. But you can do one thing in this question, that you will go through this part. It would be talking about overview of the snake bite. Then it is talking about the statistics. Then it is talking about the brown snakes. The only part which can have hair or underarms thing would be when you are treating the patient. Only then you can talk about the hair underarms. So that is where you should be able to judge that it can be fourth. It can be D. In exam, it would not be 1, 2, 3, 4. It would be A, B, C, D. Don't put as 1, 2, 3, 4. They will not give you any marks. You have to write A, B, C, D. Sorry. Next thing, talking about various questions. So please do not judge yourself, because if you do reading of this kind, you will score only 10, sometimes out of 20. That doesn't mean that you will not pass. It is just a reading to practice. Some readings are not really up to the mark. You don't have to blame yourself. Please be courageous. Again, I was teaching my students and telling the same thing. When there can be many upsets which will happen according to the goal chosen. If I think about having a chocolate, it is a simple goal. When I was a kid, my parent used to say, no, don't eat chocolate. But after 5 or 10 minutes, if I cry, I will get the chocolate. In the same way, when it comes to OET, OET is a bigger goal. Even if we cry for 2, 3 months, it's not a bad deal. But at the end of the day, we want that chocolate in the form of OET. In the same way, when you will pass your OET, you will become registered nurses and doctors. Then you will have craving to buy big cars. You will have craving to buy big houses. That also will take 2 to 3 years. Then also you have to be patient. So please understand, it's kind of a goal that's going to take bit of energy. Don't get upset. There would be many failures. Sometimes you do not get the chocolate after crying for 5 minutes, but that doesn't mean that you do not eat chocolate forever. You keep on trying, one day you definitely get the chocolate. So please understand, please behave responsibly and don't get upset about small things, especially the readings like this. So again, talking further, then we had a very good question. We discussed the death rate in males. This is a very good question to learn for everyone. One question of this kind can come in exam where you will not find the exact word, but you can rephrase the word by your own thinking. Like this question is a perfect example to that particular thing. The death rate in males is more than dash that of females. Obviously females, ये तो obvious है. This is obvious. Males can be compared with females. So the one word I could find automatically. The death rate in males is more than dash that of females. That is obvious. मेल का कंपैरिजन आप फीमेल से ही करोगे ना. सो ये तो पक्का था. इट वाज 100% श्योर दैट फीमेल death rate in male is more than female. Now I had to go to this reading. I went to this reading and I could straight away found the word male and female. Then I could see that 41 are the males, 17 are the females. Then I calculated 17 plus 17, 34. 34 means double. So that means males are 41. That means more than double of females than that of female. So I could find my answer, but original answer of this reading has been given as twice. Original answer twice दिया है rather than double. But that's okay. In exam, you will have this kind of one question only. But if you can crack this question with your intellectual ability, that is a plus. So please try and do these kind of things. Then there was another thing, like 16th question, by chance answer is given wrong, and you sometimes do reading, and suppose if I am not there for you, you are not a part of Dr. Bcam, or you are not taking coaching from Dr. Bcam, or you are practicing yourself at home, this kind of reading can dishearten you. So please don't get disheartened. Try to learn. This is a very special reading. In a way, this question paper has been created very nicely, but few questions are wrong. Like brown hair word was not given, so this kind of a question won't come. Symptom word was not given, this kind of a question won't come. But clinical feature is a kind of a symptom only, so you need to understand. Then brown snake is the commonest of the species causing this. So when I went on to this question, obviously I will go to part C, because that talks about brown snakes. Then there was given that severe envenoming is characterized, this collapse appears to occur at the time of coagulopathy. Then this word was given, the major clinical feature is venom induced consumption coagulopathy. I cannot fit in 4 words, so I will try to write 2 words or 3 words. Then I thought, but this is a hyphen, if you will see. So if there is a hyphen, then these 4 words become 3. Now I can fit in 3 words. So when I go to question again, brown snake is the commonest of species, causing venom induced consumption coagulopathy. So this should be my answer, because this is the major clinical feature. That means it causes this thing. Clinical feature is also symptom, so it causes this thing. Obviously this should be my answer, but in this, answer has been given as death, but no way we could relate it to death. So please do not judge yourself. Just doing one reading and getting upset is not a nice idea. This question was a very special question. Again, either this will come or this will come. It can be only one question of that difficult type. But if you can understand these questions can be terrific for you. So bandage must remain on dash the patient is in hospital. So what I did, I could find the word while. While means the bandage must remain on while the patient is in hospital. So when the patient is in hospital, then bandage should be on. So I was speculating. Speculating means I was trying to guess this kind of a word, that while word should come. But when I went to the reading, it was talking about bandage. Then it was talking about bandage. This bandage does immobilization. So again, this kind of a question will not come, but something to learn. So pressure immobilization should only be removed. So then I went to question. The bandage must remain on. Opposite to it, this should only be removed once the patient is in a hospital. So that means pressure immobilization, which is equivalent to bandage. Pressure immobilization should be removed once the patient is in hospital. Once the patient is in hospital. So I understood the point that bandage must remain on until the patient is in hospital. So that was the word I could fit rather than while. So that means until the patient does not reach hospital, until the patient is in hospital, please do not remove the bandage. It must remain on. So that was given. And then you could see the bandage must remain on until the patient is in hospital with anti-venoming available. So with preposition with. So that is why I say prepositions are very important, with antivenoms available. So these kind of, even okay, this was difficult. At least you could have done with word with antivenom available. Now you will see, sir, over here must is given, over here should only. You should means an advice, must means a strict advice. So should and must are equal. Must means strict advice. So this only is covering that strict word. So pressure immobilization should only be removed. That means it must be removed only when the patient is in hospital. That means pressure bandage should not be removed until the patient is in hospital. It should be kept on. It should not be removed before the patient reaches hospital. Once the patient will reach hospital, we will remove the bandage. So that was the thing to learn. And then serious reactions with antivenoms are, so then serious reactions was given here. Serious adverse reactions antivenous are uncommon. So this was an easy answer to find. So what I want to tell you by this particular reading, that if you are having a bigger goal of your life, like becoming an NHS nurse or a New Zealand nurse or an Australian nurse or an Irish nurse, please understand everything won't come easy. So don't get upset. Just behave like that adamant kid who wanted chocolate at any cost. Just be that kind of yourself. Just go in your childhood and try to be the same kid again, who doesn't want to lose, who is not ready to accept failure, who wants to win at any cost. That is how your mind frame and mindset should be. This is Dr. Bhupesh from Dr. BKM Institutes. Again, telling you not to get upset due to readings like this. When you know here word is not given, this word is not given, don't create panics. Please do not judge yourself. Now, like, subscribe, and share the video with your friends if you like it. This is Dr. Bhupesh once again from Dr. BKM Institutes. Our contact number is 7696734256. Thank you very much. Okay.